So where are you feeling the pain right now?
Low back and tailbone area. When I sit down, it hurts too.
So when you sit down, is it worse?
Yeah.
I have her lying down because this is a good position when we suspect disc problems.
From a 1 through 10, I would rate a 7.
So it's calmed down a little bit
Yeah.
from lying down like this. Okay. Now you're saying you've been putting heat on it in the shower.
But when I go to bed at night, I lay on my back.
You
but
lay
I
on
put
your
a
back,
pillow
but then you put...
underneath.
That's okay. That's okay, but you're putting the heating pad on your lower back.
Yeah.
And going to bed with a heating pad on there is not good for the
Yeah.
discs.
Yeah.
I want ice, ice, ice.
Okay.
No going in the shower with the jet stream there. That it makes the muscles relax. So if it was a muscular issue, you would notice it getting better. If you strain a muscle, it's still not good to put heat on it in an acute or short, like recent injury. How long have you been feeling this?
It's been over a year.
This has been over a year. Is it anything getting better, or is it just kind of staying the same?
When I went to the acupuncture, it got better. But then when I stopped going, the pain comes back. So it was
well, so then they're not figuring out something for you to do long term. And has anybody recommended imaging?
No.
So what I would do is I would need a MRI of your low back because I can't feel a disc herniation. I can't feel a disc bulge. Even though we can do these tests and we kind of get an idea of where it lies, that disc, it's still, without the imaging, I couldn't know. Have you been to anybody else for this?
No.
Nobody else? Okay. Like your primary health care provider? Or your main doctor? Or
the only thing she told me is that I need to start going to the gym and build muscles.
Okay. So if you want to use your insurance for the MRI, what you need to do is go back to her and say, it's been however long, I'm not getting better. I'm doing the gym, I've been to an acupuncturist, I've been to a chiropractor, nothing's helping me. I need imaging. Okay. Now what they will do is they will offer you what they call, it's called informed consent. Okay. They might want you to go speak with a surgical consult. In my opinion, you're too young, okay, for all of that. But what they'll do at that point, they're the people that offer you injections and steroid injections. I don't offer that.
Exactly.
Okay, but know that it's not a quick fix, this stuff. You're gonna be better, hopefully, but it's not fixed. Just like your acupuncturist, you had to keep going until you understand up here how to help yourself. And that might take 4 or 5 visits. Usually that's how long it takes people to understand what they can and cannot do with their body. It usually takes me about 4 or 5 visits to get this to go away.
Okay.
If it doesn't go away, or you don't feel better, like at least 10 to 20% by the end of this, I'm going to say this might not be for you. Okay, so I'm going to teach you the things that you have to do for the rest of your life. Okay, that you should have been doing. Let's start out with no heat. Okay, let's start out with that. That might get rid of 50% of your pain, not constantly inflaming that area.
Exactly.
That's that. Do you know what caused this, or was there any kind of event that started this?
I think it was 2 years ago. I was working for a nursing agency at the time. Okay. And I was picking up an elderly client. Yeah. I regret doing that.
Yeah,
ever since I did that. Exactly. That's the same thing my mom said.
Why don't we help our nurses and our healthcare workers so we can properly help the patient, you know? But you're saying you just picked it up the patient and...
I strained my back.
You strained your back. Did you feel like your legs give out or anything like that?
My legs, yeah. Okay. And I could feel it right now, a little bit.
The pain? Okay, when you flatten back out, does it feel a little better?
Oh, yeah.
Okay, let me do a test here as you're sitting here. If I press down like this, does that make it better or worse?
Actually makes it a little bit better.
A little better? Okay, well that's a good sign. Let me just hold it here for a second, okay? I'm just giving that disc a little bit more space. I want you to lift this leg straight up for me. And just hold it straight up. Hold there. Hold there. Any pain when you do that?
Pain right there.
Right here?
Yeah.
Now how about if I'm not pressing? Any pain?
No.
So I want you to hold that for 10 seconds. Lift your leg up, hold 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Relax. Relax. Shake, shake, shake here. Wiggle the pelvis. Go ahead and wiggle your pelvis. Yep, like there you go. Yeah, go ahead. These are your exercises at home, okay?
Oh, okay.
Shake, shake, shake. Try to get some gap in here, okay? Now, next leg, straight up, 10. Now, does that hurt? If it hurts, then lower the leg down. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Good, down. Did that hurt when we did that? No? Okay. Yeah, it's all swollen in here. Especially over here on the left.
Yeah.
And that's the side, yeah. It's right here. So if you were to cough, it would go down your leg?
Well, not coughing, it's sneezing. I have allergies right now. But if I were to sneeze, I would feel a whole bunch of pain back here.
Okay. Yeah, that's definitely... That's called a Valsalva maneuver. So you're increasing the pressure in this space. Even going to the bathroom would hurt. Now, have you lost any bowel functions or
No.
Like the ability to urinate?
No.
Okay, that's a good sign. If you have any of that, okay, you need to go to the ER.
Yeah, I know that for sure.
Okay. Yeah, so this might be so tight from the sneezing. Any pain down into here?
Yeah, I feel right there.
Right here, and then I'm going to compare it to this side. Oh, wow.
Yeah.
Your SI joint is... Any pain though when I press?
Yes.
Is it worse than this side?
Yes.
Yes, it's worse over here.
Oh my God.
Really swollen, her whole left SI joint. Just lightly press here. Does that increase the pain down the leg? Does it set it off?
No.
Take a deep breath then for me. Oh, it's really tight. No, I'm not going to go any lower than this, okay? Just to there. Deep breath in. I'm going to push here. That's all it goes. Okay, here we go. Deep breath in again. Okay. If you want to come up on your elbows, you can as well.
Okay.
Any soreness down in here?
Soreness, yeah.
Like right in here? Is this okay? Here we go. Oh, wow. When's the last time you went to your medical provider?
I think it was January.
Okay. I need you to rest after this, okay? Just walking. You can walk backwards. You can walk up a hill backwards. Just don't fall. It's all swollen. There you go. We got one over here, okay? Breathe. There it goes. And breathe, 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 breathe. There it is. All right.
Oh my God.
Good, good. Relax.
Oh my God.
You all right?
Yeah.
Don't really want to press on that side. It's not as bad, but it's still tight. I want lots of water after this too, okay?
Drink lots of water?
Yeah. Need you floating. This isn't pleasant. Oh my goodness gracious. Oh my. Yep, and you're all swollen here, okay? You're bruising pretty quickly.
Because I'm skinny?
No, because you're swollen. She's swole. That was a new word I just learned.
How have you not heard swole?
I have never heard of swole.
Impossible.
I know, this is like my profession. Everything's swollen when people call me. Your poor low back. It's like, help me. We're getting it. Now the next move I'm going to do is not the disc or the joint, okay? It's just the skin. I'm not going to mess around with the joint. Here we go. Pinch, 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 pinch.
Woo!
Good.
Oh my god.
That hurt? You all right?
Oh my god.
Okay. That was above it, the segment, okay? Couldn't quite get the one. Well, there we go. So the one that's hurt is this one down here. I can't, it's too swollen for me to get it, okay? I'm not on the joint. It's just the fascia. Just to get some blood in there, okay? But that's what came out.
Oh my gosh.
Just from that little bit that we did. So where you're swollen is down in here. But this, your whole rib cage is stuck. It's not moving. Wow. So guess where all the work is done? Right where you're hurting, and your body's kind of like, help. And then try to move these ribs. Get them moving for you, all right? As best we can. Now all this doesn't have to be done every time, okay? But we're gonna get this first layer out. Okay, here we go. Breathe. Here's the bottom part of the nerve in your back, right here. Oh, poor thing. It's all swollen even down into here. Look at that. This one too. So that's from this being pinched. It even feels it down here. Even though it's not giving you pain yet down here. The nerve is all one piece, one cable. It's right here, that's the nerve. Oh my, it's all swollen. Wow. Okay, breathe. Tell me to stop and give you a break if you need it. Right there. Okay, breathe.
Oh my God.
This middle one here? Okay. See, watch this one. Okay. See the difference?
Yeah.
I have to actually go lighter on this one. Okay, give you a little break. This is what we do. Okay, breathe. Worst one right here. Worst one. Breathe. Take some breaths. Here we go. Let it out. Let it out. Here we go. Good. There it goes. Okay. All right. Okay. Now what I want you to do, I'm going to put your sock back on here. No bending over to touch your toes. You got that?
Okay.
No, I'm trying to tell you all the things that you don't do. Hands go here. Yep. See if you can do a cat-cow. Don't worry about that.
Feels good.
Feels okay? Now round again, but I want you to round through here.
Oh, you mean right here? Up here?
So tuck your chin to your chest and pull up through the ribs.
Oh.
That's it.
Okay.
Now you're going to push down through your ribs. Look up. Look back. That's it. Wiggle the hips. Wiggle the hips. Wiggle the hips. That's it. Okay? This is how you help this area. Okay, when you're feeling like it's going out. Okay, this is how you help it. All right, now take a seat right here. Just have a seat.
Okay. Sit down?
Yep, just take a break. Take a break. See how it feels. I'm not done. Just take a break.
Oh my gosh.
You're all right. You're all right. I know this is
good though.
Dr. Mondragon's sweating, so we always have like stuff. I'm like, whoosh, but I sometimes freeze my patients out. All right, here we go. This is your good side. One side. Okay. Ooh, that's it. Yeah, I've had people when I work up here, they're like, I feel it in my back. Because it all pulls. It's like a string, like on a cable. It's the whole thing. Okay. There's one. You're okay. You're okay. That was one. Right here. There we are. Breathe. You're doing great. How'd that feel?
That feels good.
Feels good. Yeah, none of this should feel too bad. The adjustment's the easy part. There she goes. Where's the rest of it? Okay. There we go. Chin back for me. That's it. And relax. That's it. Roll to your side. Yeah, any way you can. And then push yourself up. And push yourself up.
Oh.
Now use your hand to lift yourself up into a seated position.
Like this?
Yes, that's how you get up with your low back, and then you're gonna come all the way up. Come on into seated. Yes, there you go. I don't want you doing a sit up.
Oh, okay.
Push your elbow back into my hand. There it is. Elbow back. Good. So what I'm gonna have you do is come on down to the floor. Go on and have a seat down here. I'm gonna sit down on the floor. Okay.
But I could feel that it like eases the pressure off.
Yeah, you're just trying to get some traction on there.
Okay.
So you're gonna have your arms up like this, and you're gonna come to the side. Just roll.
Oh, okay.
I don't want you to do a sit-up and then undo what we just did, or what you just did. Okay, you just went backwards. If you do a sit-up over
this,
this,
like dizzy or something.
no, it won't make you dizzy.
Oh.
You're pulling out the curve, right? I just took you back into extension. Come on and stand up and see how it feels. Don't worry about the blanket. That was just for you.
Okay, thanks.
Well, you're straighter.
Mm-hmm.
Now, how's it feeling in the leg?
Well, this like definitely feels a lot lighter than before. Before it felt heavy.
Okay. So you feel about 10%, 20% better?
Yeah.
Okay.
Mm-hmm.
So then we have somewhere to go.
Mm-hmm.
You know, if you're like, no, I'm just dying, then I'm like,
Mm-hmm.
yeah. Now, I know you like to stand. It looks like you like to stand.
I do, like, when I bend, it gets painful. But
I want you to do a squat. I want you to do a wider stance.
Okay.
Because it's got to heel. And now you got to go down like this and pick these things up.
Yeah. I can kind of feel it like this. Right.
Yeah.
Yeah.
Or you come down on one knee and pick something up. Do you understand?
Yeah.
Okay, you can't.
So that's how I have to do it.
Yeah, you can't be doing this.
Yeah, because when I do that, I feel the strain.
Mm-hmm. That's your body telling you something.
Yeah.
Don't do that. Eventually you will be if it heals enough.
Mm-hmm.
But right now you can't.
Mm-hmm.
Okay. You have to figure out what you want to do. Okay. Let's learn. Now put the shoe somewhere where you can reach it.
Okay.
I don't care if it's on the table. Take this one leg up, stretch.
Okay. Sit on the chair.
No bending forward though. Everybody does this one. I'm like,
Oh.
don't do that. I don't care if you bring your leg up to meet you, but
like
I don't
this.
want you to take your low back and bend it forward.
Mm-hmm.
That's a lack of flexibility in the piriformis and in the glute.
Yeah.
There you go.
Whew.
She did it.
Relief.